Now, in the fourth section, we will talk about the post-operative care of the patient after the tracheostomy is performed. In this section, when we will talk about the post-operative care of the patient, we will especially talk about the suction, prevention of crusting and tracheitis after the tracheostomy is performed. All these are very common complications that can occur after the tracheostomy if proper care is not done. Then we will also talk about the decannulation and failure and complications of decannulation. So the post-operative care of the patient with tracheostomy, constant supervision is very important after the tracheostomy. And why we need this constant supervision? For bleeding, for displacement of the tube or blocking of the tube. It's very important that we should do the close observation of the patient, because if there is bleeding or if there is blockage of the tube, it can cause breathing problems. So close observation is very, very important after the procedure. Removal of any secretions that can cause obstruction of the tube. So removal of secretions are done constantly after the procedure. Then suction. Sterile catheters with Y connector are used for the suction of the secretion. Suction injuries to tracheal mucosa should be avoided. So when we do the catheters for the suction, they can cause the injuries or trauma. So it's very important that we should try to avoid those injuries associated with the suction. Then prevention of crusting and tracheitis. With these secretions, it can cause crusting and infection of the trachea. So it's very important that we should do the proper management after the procedure to avoid crusting and tracheitis. Proper humidification is important to prevent any crustings, and normal or hypotonic saline or Ringer's lactate is instilled to prevent the crusting. So it's very important that we should prevent crusting, and we should take the measures that we can prevent the infection of the trachea leading to tracheitis, and then can cause other complications associated with the tracheitis. Care of tracheostomy tube is also very important. Inner cannula removal and cleaning. We should clean the cannula, and inner cannula should be removed and cleaned. Outer tube not removed until displaced or blocked. So it's important that inner cannula should be properly cleaned and managed. Outer cannula is only, or the outer tube is only removed when it is blocked or displaced. So these are some very, very important considerations when we talk about the post-operative care of the patient with tracheostomy performed, and proper management of the patient after tracheostomy is very, very important, because we know it's the association. Now the patient is exposed to the external environment. If the proper care is not done, then we can predispose the patient to so many different infections present in the environment and in the air. Decannulation. Another condition or topic we will discuss in this section now is the decannulation of the opening performed for the tracheostomy. Tracheostomy tube not kept longer than necessary. So if the indication for which we require the tracheostomy, if it's over, we need to remove the tube immediately, so the closing of the opening can be done, which is known as decannulation. Prolonged use of the tracheal tube cause tracheobronchial infections, ulceration of the trachea, granulations or stenosis, and unsightly scars. So prolonged keeping of the tube can lead to all these different conditions and complications, so it should be avoided. Tracheostomy tube is plugged. Patient is closely observed. If tolerated for 24-hour removal should be done. So the important thing is if patient can tolerate for 24 hours, then we should do the removal of the tracheostomy tube. Patient should be observed closely if the tracheostomy tube is plugged or blocked. So we should observe the patient for 24 hours. If the patient is working fine without the tracheostomy tube, it should be removed. In children, done using smaller tube. After removal, wound is taped. Patient is observed and healing within few days or weeks occur. So after the tracheostomy tube is removed, patient should be observed very carefully, and then the wound should be taped, and it takes few days to weeks to heal completely. Decannulation in infants and young children. Decannulate in operation theater to the infants and children. Equipment for re-intubation should be available. So it's important that when we decannulate or when we remove the tube, we should be in the children, we should be performing this procedure in the operation theater, because after the tube is removed or decannulation is performed, if the patient has breathing still abnormality, we should be able to intubate the patient immediately. After process, watch the child for distress, for tachycardia, for any color oximetry, blood gas determinations to look if they are breathing fine. Failure of decannulation. Look for the causes of failure of decannulation. Persistence of condition for which tracheostomy was done. So it's important if the decannulation is failed, if the tube is removed and patient is not working properly or functioning properly, we should find out what are the causes of this failure of decannulation. Look for the causes of decannulation, and the very common cause might be the persistence of condition, any obstruction for which tracheostomy was performed. Obstructing granulations around stoma and below it, tracheal edema or subglottic stenosis, incurving of tracheal wall at site of tracheostome, tracheomalacia, psychological dependence on tracheostomy, inability to tolerate resistance of upper airway. So all these are different causes in which there can be failure of decannulation once it is performed. So in children and in infants, it's important we should perform in operation theater. In adults, we should observe the person closely for at least 24 hours. If they work fine, if their functions are fine, we can remove the tube. Complications, immediate complications at time of operation. We have hemorrhage can occur, apnea, no breathing, pneumothorax, injury to the pleura. Pneumothorax is the air in the thorax that can occur as a result of injury to the pleura, which is the covering of the lungs. Injury to the recurrent laryngeal nerve, aspiration of blood, injury to esophagus. Then we have within few hours to days intermediate complications, bleeding, reactionary bleeding or secondary bleeding, displacement or blocking of tube, subcutaneous emphysema, tracheitis and tracheobronchitis, atelectasis and lung abscess, local wound infection and granulation. Late complications, hemorrhage or laryngeal stenosis, tracheal stenosis or tracheoesophageal fistula, problems of decannulation, persistent tracheocutaneous fistula, keloid or scars, corrosion of tracheostomy tube. So all these are complications that can occur with decannulation. We have tracheostomy tube present for a long time. All these complications can occur, which can be immediate, intermediate, or long, depending on what type of injuries or traumas or conditions were associated. So these are all the complications that can occur. So that was all about section 4. Thank you for watching sqadia.com.